using estrogen as effective replacement, if you had a preference into in terms of dosing, method of taking it, and if you could just speak to that a little bit for
Well,
menopausal women.
So I lecture a lot for A4M, and there's two relicensing groups for becoming a functional doc. There's IFM and A4M and things like that. But they're very, very conservative, and they teach start at the lowest dose and go to the smallest dose that just gets rid of your symptoms. But I don't really agree with that at all, because what you really want to do is where you really slow down aging is by maintaining the volume of your hippocampus. Your hippocampus is where you live. It's where your memories live,
Right.
your orientation, your motivation, and it shrinks after the age of 40, 1% a year. Normally, if you don't have hormones on board, because you don't have hormones on board, because the hippocampus makes hippocampal estradiol in response to a woman having estrogen in her bloodstream and to a man having testosterone in his bloodstream, because the hippocampus has a lot of aromatase enzymes which convert that testosterone to hippocampal estradiol. The larger your hippocampus, the more you feel like your old, better self. Although I was older before my time, so it's not me, but most people say when they get older, I don't feel like my younger version of myself. And a lot of that has to do with your hippocampus. And there have been studies done where they've looked at the dosing of estrogen to figure out what doses really maintain a healthy hippocampal volume. And the great thing with the hippocampus is it's like the liver. There's not a lot of organs in the body that can regenerate. If you have a whole bunch of kidney stones and you have a lot of lithotripsy, you lose a lot of renal mass. You don't grow more renal mass. I worked for 10 years in a dialysis center here with Dr. Moncrief, and we co-invented a dialysis drug together. And that was a whole nother part of my life. But there were a number of our patients, they had multiple injuries to their kidney, and you can't reboot your kidney to a certain degree. But your liver can be rebooted, and your hippocampus can be rebooted. If it shrinks up from being an older age, it can revolumize as long as it hasn't gotten where it's like a raisin in pathological Alzheimer condition, and it's gone beyond where it can respond. And so you want enough hormone on board where silently you're maintaining the volume of your hippocampus and the integrity of your bone and many, many other places. Hormones aren't just about sexy and reproductive things. Like your lungs are completely lined with receptors for progesterone. Progesterone has a lot to do with lung repair. So Mount Sinai did a study with COVID patients, male COVID patients in the ICU, and they gave them 100 milligrams IM BID twice a day of progesterone and tracked them with men who were getting standard of care. And the men that were given progesterone plus standard of care left the hospital in shorter days there with less complication, because they were able to know that progesterone helps heal the lungs. So we're more prone to pneumonia as we age because we don't have more progesterone. So we give men progesterone. We don't give just women progesterone, especially with congestive heart failure, etc. So to give hormone dosing to the point where you're getting these silent but internal things that have a lot to do with your keeping you the way you used to be, really resilient and strong. So the typical dose of estrogen is somewhere between 0.6 milligrams to somewhere like 2.6, 2.8 milligrams of estradiol equivalents. And you have to add in estriol with that. But they're outliers. There's some people who can't handle that at all, and they need less. And there's some people who need more. David Rosensweet tells the story of a gynecologist he met who had sat with her mother in the dementia unit. I lived with my mother in the lockdown dementia unit all through her dementia journey. But her mother had dementia, and she was still seeing patients. She was in her mid-60s, and she started to lose words and feel like she was. And she was on hormone replacement. So she kept upping it till she felt like her brain turned on. In other words, her hippocampus enlarged. She did it to the point where she started menstruating again. And if she kept herself menstruating again, she kept her cognition bright and she could keep seeing patients. So she shared with him that she was on 8 milligrams, which normally in most women would downregulate the system, but on her it didn't. So we have typical dose ranges and then we have outliers.
Right. And was that oral estradiol that he was giving?
No, we never give estrogen orally because then it goes through the digestive tract and the liver, and the metabolites that it makes can be pro-coagulative and inflammatory. And that's why in the studies where they say that estrogen causes stroke, it's because it was swallowed. Or they say that estrogen causes dementia, it's because it was given with progesterone or it was swallowed. So you have to look at the caveat of the details of the studies. So the safest way to take in hormones, although every woman is different, and throughout your life, you might, if you're on hormones for decades, you might need it one way in a few years here and another way a few years here. But sometimes you can take a hormone topically and you can take it vaginally. But we usually don't like taking hormones orally except for progesterone. Progesterone is a very safe one, and you want it to go through that first hepatic pass because then it makes neurosteroids, which are very brain protective. In a young person, progesterone is produced as well as estrogen in 6 different areas of the brain to protect the brain. Hormones are extremely brain protective. Many of my colleagues feel that if hormone replacement was pushed, educated to doctors, and encouraged in patients, that 85% of our people with dementia would not have it. We'd have less Parkinson's, less Lewy body disease, less Alzheimer's. And, most of my friends can't even talk like I can talk, or because I felt comfortable with pushing for a long time because of having breast cancer. I did that smallest dose for the smallest amount. And then after the reanalysis, I went whole hog and my brain went turned back on. And I have noticed such a difference in my 75-year-old brain with my girlfriend's 75-year-old brains. It's huge. But of course, I work out every day and eat really well and do a lot of other things most of the time. But it's very aggravating how many people have Alzheimer's disease that wouldn't have it if they were allowed hormone replacement.
Or osteoporotic fractures or cardiovascular disease. So many other things.